or just lightly on the person, just getting to know the body so that the body is ready to receive you. Never pat, and you can rub a little bit, but be careful in the sections of the buttocks or any of the private areas. Resting position is just for the body to be aware that you're about to come and start the massage. First, what I'm going to do is show you all of the moves without on the body. I'm going to just do it over top of the sheet and the blanket. And you're more than welcome to do this too. So if you have a client, you can even have your friend or your whoever to be clothed and just practice all of the techniques. The main thing is the techniques. And once you know the techniques, really how you put it together isn't going to matter because every body is different. So the first one is effleurage. Effleurage is any long gliding strokes. It doesn't matter if it's on the back, it can be on the arms, it can be down the legs. It's just long gliding strokes. Exercise has a few in there. Kneading is one of them. Kneading is like a cat. So a lot of times where I do the kneading is either around the bottom end, around the glutes maximus and medius, and the thighs, and it's just like a cat. You're just going to get in there and knead. So a good area to do it on is the thigh, the upper thigh, because it has some meat and you can feel what it feels like to knead. You can always ask whoever you're using as a client to feedback if they think that feels good or too hard, too heavy, too soft. Vibration is an up and down movement on the muscle. Usually with the vibration is down the spine, and it's just a shaking the hand side to side or up and down, just like a shimmy. It's just a little shake. If you come off the body and do it, it feels different for the client. Shaking is shaking. You're shaking the body up. Sometimes you need the shaking motion if you find that the muscles are too tense and they're not loosening up. Sometimes giving the body a bit of a shake helps to loosen the body up. Rocking is more of a gentle motion that has more of a rhythm to it. So it's just a little bit of a rocking. Sometimes in the beginning of a massage, if you want to know if the person is tense in the upper body or in the lower body, you can give a little bit of a rocking just to see where the body is with their muscles. If they're tense, or percussion has a few there too. Hacking. A lot of times hacking is done on the thighs, calves. You might have to lighten up on the calves. Cupping is just like a horse, where you cup your hands and then you can do it on the upper chest. It's great for coughs. Coming down onto the thighs, never spank the bottom end. It might be like a spanking, so you don't want to do that. Beating is with the little finger coming down. So beating again too, you can come sometimes real lightly across the hips, the side of the body, coming down the thighs. Once in a while the calves, you need some meat to do it on. I wouldn't do it on any bone. So beating, pounding. Pounding is the same thing, just where you're using then the knuckles. Now there is slapping, and usually where people might like slapping is on the bottom of the feet. And tapping. Tapping is like playing the piano. And you're just going across the body. It's very light. Again, it wakes up the muscles. And friction is any muscle in the opposite direction. So I'm just going across. On the list, it's also called ironing. In general, the massage follows certain principles. First one is superficial to deep to superficial, meaning I'm doing light, and then I go deep, and then I go light. So if I'm working the area, I might work this muscle out, and I'm going very light, and then I might go in there just a little deeper, and then I finish again superficial, so very light. And then you're going to go proximal to distal to proximal. So I'm going to start at the upper body of the back. I'm coming all the way down. You'll see the massage coming to the feet. I'm going to turn them over, and then I'm going to work my way back up to the head. So proximal, distal, proximal, head, feet to head. General to specific to general. General means I'm going to do this whole upper body. So let's say I'm pretending, or here I am effleuraging, in general, the whole body. But I feel that her muscle in her trapezius is out, and now I'm going to work a specific muscle. So I'm going to come work that muscle, and then I'm going to go general again. So in the massage, you're going to start from the upper body to the feet, back up. When you turn the person over, then you come back up front of the body all the way to the face. So head, toes, flip over, back up to head. General, every body part is going to be done in full, and then if you find a tender area that needs work, then you can go specific, and then back to full. And also light to deep to light. A lot of times if you imagine it in count of 3, so something needs superficial 1, deep 2, superficial 3. The Swedish massage routine is a guideline only. You can make up your own massage as long as you understand the basic techniques. The basic techniques is what we care about the most. And now I'll show you the whole massage if you do want to follow a massage, so you have something before you go off onto your own. That's fine. So we're going to start with the upper body. If they're wearing underwear, you can tuck into their underwear and then just fold back. If not, just fold back. Grab quite a bit of oil. If you cup your fingers, the oil will stay in there longer. You don't want it dropping onto the body. So now I'm going to just warm the oil up just a little bit. If you do have a machine that can heat it, that's fine. And now just put the oil onto the body. And effleurage over the entire back. No pressure on the spine. And it's telling you to do it about 3 times. Again, if you do it 4, that's fine. Feather. You're just following one hand behind the other, all the way up. Other side. Palm or knee upside of the back shoulder closest to you. Circles on the back, one with 2 hands. So palm or knee, your palm is what you're kneading with. And so now what you're doing is you can start at the lower, work your way up. If you want to, you can change sides. I always try to keep a hand on the body when I'm changing. some of these movements are actually for you, so that you're not using certain parts of your body only, so your hands and your wrists don't get so sore. Open C's, it's more like a scoop, so pretend now your hand is like a C, and I pretend that I have sand that I'm moving, and you're just going back and forth over the muscles. You can speed it up or slow it down. Thumb finger, so you can use your thumbs or you can use your fingers around your scapula. So you feel the bone, and you can either just even run them. They usually feel better though if you move your thumbs. They can be very tender on some people. To see it better, if you move their arm up, you'll feel that bone a little bit more in here. You can pull up onto the arm with your arm going up onto the shoulder, and you're really using the meat of the arm. You can pull up on the opposite side, but just avoid if it's a female. Make sure that you watch where the breast area is so you're not pulling up into the breast area. And then you get to play and do whatever you want. And whatever you do on one side, you can do on the other. And again, the order isn't as important as actually feeling those muscles. So on my client right now, I can feel that her tenseness is right up in here. She's very pliable and loose, and her skin moves very nicely. And then it gets really, really tight right in here. So I might want to give it a little bit of a shake, let it wake up. You don't want to work anything forever without giving it a little bit of pleasure too, because the body just can't handle pain for too long. You can come backwards onto the body and give a little bit of a push. You can rub into the shoulders. Some of this stuff isn't in your books, but you're allowed to mix and match. Try not to rub into the neck if you can. Rub down. So if you're going to rub the neck, just rub it down. That way you don't put liquid into the head area. You're bringing the liquid down into the back. And then when you finish off, you can finish off with effleurage. Then you can just cover them up. Now lower back. So this is where you could have gone where I was facing down. You can do the vibration down the spine. You can do this also without the sheet. You can do reinforced kneading, lower back, hip area. So you can do that part with or without the sheeting. With the buttocks area, because there's a lot of skiers and a lot of runners and a lot of people who are athletic who need their muscles also worked on onto the buttocks area. Ironing, just going across, just on the lower back. Reinforce heel of hand. Now, with the crease line of the buttocks, I always stay a bit further this way, and I always do it over top of the sheets. Some people are comfortable to have the sheets right off, and some people put the sheeting right in between their legs. A lot of our clients aren't, and a lot of our students aren't comfortable with it either. So it really depends on your comfortability and your client's comfortability. So reinforce heel. You're just loosening up the muscles. And you're staying away from the crease line. Kneading. You can knead on women. It's great because if you have any problem with cellulite, cellulite has to be warmed up and moved. So the motion of massage is wonderful for anybody with that. Beating, pounding. Again, just not too close to the bottom end because it might feel like a spanking. The faster you go, the more stimulated they'll be. The slower you go, the more relaxed they'll be. Other side. And a lot of times I'll leave two hands on the body, even if only my one hand is moving. That way the client always knows where my other hand is. Some people are not comfortable with massage. Then you can finish with an effleurage. Draping. When you come down to the legs, I move the blanket over because I don't want to get oil all over the blanket. So I move the blanket over a bit. You pick up your sheet and you accordion it. And one's by their hand, by their hip. The other one is down closer to their heel or the ankle. The one that is down by the foot, you move over. So you're just draping it across them. So it just comes over. Your hand, I usually start with my hand on the ankle to tell them that I'm coming in. I lift underneath their ankle, come and protect their knee, take the corner of the sheet, and have it pass the part. So the part here that I have, I'm passing to her hand, and I can tell her to pull up. And what she's doing is she's pulling the sheet up between her legs so that she's protected. So she knows that she's covered and she's protected. Get some more oil. I let it warm up for a second. And then you're going to take half the oil and go both directions. You're just putting oil on. Now, you can have a choice. You can do upper leg, upper thigh, and then lower leg, or you can do it all together. So with the upper leg effleurage, I like to effleurage the whole leg at once. You can cross your hands and do it. Again, do not go underneath the sheet. Your fingers should stay just wherever the skin is. If somebody has on, let's say a man has on boxers, and the boxers are coming down halfway down their leg, you can ask them to pull up the boxers, or all you do is you get to massage just to the bottom of wherever the boxers or the underwear go. You can feather. And when I feather up, I usually glide down. It just feels better. You can come off foot. Again, I try to have kind of one hand on the person at all times. Open C's. The Swedish massage can be quite a deep massage, so depending on your client, you're going to find some people you go deeper with than others, so meaning you use a heavier hand. But don't forget, you can also hurt somebody, so make sure the pressure is what the client likes. But also not just what the client likes, what you can handle. Because if your wrists and thumbs go, you have no occupation anyways. So I've passed clients on to other practitioners who can do a deeper massage than me. And especially in the beginning when I was learning. Over years you do get stronger. You can do kneading. You can do hacking. It's not really hard that I'm doing it quite light. Cupping. Depends too, try different angles. You might like that you go up differently than you go down. Squeezing and picking up. There's some of these that I don't use on people. They just don't work very well on everybody. So don't worry if you don't use them. Shaking. Reinforced Palmar glide. Open C's. Down on the calf, it has alternating thumbs. You just make your thumbs go so that they're just going one at a time, kind of like you're feathering, but just with your thumbs. Finishing with an effleurage, a light, so superficial glide. If you wanted to, though, you could work on the foot. Some people raise the foot up, and if you know reflexology, this is where you could do it now. Okay. Now you're going to protect the knee. You're bringing the sheet back out, covering them up. If it's too warm, you don't have to use a blanket. Doing the other side. If the oil, I use an oil for Swedish massage in a flip cap, and that way you can just close it. Some people tuck it into their pants. Some people, if it works, you can leave it onto the massage table. You don't have to be running back and forth, always trying to get your oil. Now, if their body is warm, if all of a sudden you sense a very warm area, still do the general so that you're working the body and waking up the system so that the brain knows that we're on this leg and that we're manipulating it a little bit. We're not hurting it, we're just waking it up. So we're, as touch happens, the nervous system, circulation system, lymphatic system all start working. And again, try to also sense the muscles. I would rather you learn how to feel the muscles and feel where there's a tight spot or a hot spot or a cold spot, and then take the techniques that you've learned and try to wake up that body. So here she has a bit of a tighter calf. She's not tight here, she's just tight on her one side. And so I might want to play with it a little bit. And the problem is if I follow that example of the massage exactly, I won't be able to help this muscle. And that's where the play comes in, because you really do want to help the muscle. So as you can tell, I'm not doing the same massage as what I did on the other side. The other side, though, I did follow pretty close to the example. On this side, though, I want to help this muscle. And if the person finds that it's too sore, then lighten up. You don't have to go heavy on them. A lot of times what will help loosen up the body is the foot being massaged. And so you can come and work their foot a bit more. Some people's right side or left side could be more tense, so it doesn't mean that both legs have to be, or both parts of the body, opposite parts. You never know. So she was warm up in her upper thigh. Working her lower body has helped a little bit. She's now cooling off on the sides, but she's quite warm coming up the middle. And so I just want to work this a little bit. And I might work the lower buttocks area. And depending, it can be all kinds of things. It can be a person driving and it was the pedal. It can be just how they were sitting. So work could do it. They might have crossed their legs. There could be all kinds of reasons why that muscle is overactivating, because heat usually means that there's blood and circulation coming to fix something. Cold, it usually means that circulation system is not coming to that area. And on a man, the thigh is a very ticklish area, which also can mean that it can be an arousal. So what you can do then is just give a little bit more pressure in that area, so then it won't happen. Okay. So covering them back up. Now you want them to turn over. So what I'm going to ask her to do, I'm going to hold this upper corner and the side lightly. I'm going to ask her to come down the table, so if you'll move your whole body right down the table, where your head, yep, where the head is closer to here. If they do have a hair clip, you can take that out now. You can remove the headdress. Now hold on to the upper sheet and the blanket. I hold on to the middle. I ask her to look at me, and turn right over to her back. Once they're turned over, ask if they need a pillow underneath their knees or underneath their neck. Some people do. You're okay. Over is exactly the same way as what you just did on the back. Undraping them on the front is exactly the same way that you did on the back. Getting the oil, warming it up, and applying it onto the body. Effleurage. So you can use alternating thumb strokes for the calf. Again, just where your thumbs are going back and forth one at a time. I stay off the bone. I go right onto the muscle. You can massage the foot. Use the palm of your hand, fingers, thumbs. You can also bend the knee up a little bit and massage the calf in this position. Some people like the slap of the feet here. Again, try it out with a few clients, see what they think. You can rub around the knees, little circles. Some people do X's. Effleurage, open C's. If you were doing general, specific, and general, I could do big open C's, and they're kind of more of an effleurage open C. And then I can do these little tiny ones with more with my fingertips. Gliding. I always do motions up towards the heart. The lymphatic goes to the heart, so if we are going to move any lymph, it would be in that direction. Also, mostly insertion origin goes towards the heart of the muscles. You can do a palmar glide. So instead of circles, you could do circles, but it's a glide. Make sure you don't have long nails so you don't scratch the person. Effleurage. And taking the sheet out. Doing the same on the other side. check for hot spots, cold spots, very tense muscles, and then work that area. It's little clues to tell you what area needs working. Area. We're just going to pull the sheet down just a little bit, just so that her shoulders are showing. If it's a man, you don't need to cover the breast area. On most men, make sure their religion honors it. Some men's religion won't allow the breast area to show. For covering up, put the towel across the shoulders. Make sure it's, flat. Put your elbow on the first shoulder and arc so that you're not strangling them on the next. At the belly, watch that they don't have a belly ring that you're pulling. Move the sheet and the blanket just so that you can see it. And then what you're going to do is you are going to pull the towel that you just used up until you see the bottom of the breast area. And you're going to just pull the sheet down till you are about 2 inches or 2 thumbs below the belly button. And that's all you need to be for the stomach. I like to go on to the other side for the stomach so I can follow the colon properly, the large intestine. So I've just put some oil on. You can glide following the intestine. The large intestine goes in kind of a U shape. And you can use one hand, then the other, and then glide across a transverse. Coming across, you really want to slow down because you could actually make somebody ill. The heartbeat, you can feel the aorta a lot of times. Sometimes you can actually feel the food. Making circles. If they have a belly ring, just be careful. If it's a hoop, you might ask them to only wear the stud so that you can't hook it with your fingers. Diamond glide, coming down the back, alternating. And you're really staying on the stomach here, not really going much into the rib cage. Doing little circles. When you're covering them up, just bring the sheet down, the towel down. The sheet goes up, just covering the breast about midway, and then you can just bring the towel just down a little so that you can get into now the shoulder area. Okay, Now with oil on, I want to take half the oil. My hip goes to her head, so I'm not doing this over top of the face. I took some oil and just rubbing it on. Again, the other way, so I'm not crossing over her face. The last thing I want to do is drop oil onto her eyes. Make sure your stance is good so that your legs is one in front of the other. Now you can effleurage, which is just a motion of coming around. Holding her head in one hand, you can glide down the neck. Again, be careful if somebody has a very sensitive neck. You don't have to do that. I always find out too if they're going to go somewhere, because not a lot of people have showers right after a massage, especially if you're going to use aromatherapy. You don't want them to, and so their hair might get oily. So some things I might have to miss because I don't want their hair oily. You can do under the neck circles, coming down. You can get quite far into underneath the shoulders. Again, you can always ask your client how it feels. Feels good. There's two soft spots, not in the breast area, but they're just underneath the collarbone, and you can rub those. Glide. You can cover them up a bit. And then you're going to take an arm. So you're going to ask for the arm out. I just tuck under. Oil on. I do quite a bit of also the arm. If you've taken the European lymph drainage, you can do quite a bit of the arm by European lymph drainage. You can knead, palmar knead. Glide, double glide. You can use alternating thumbs. Knead the arm. For the hand, you can just rub it. You can use your knuckles. The European lymph drainage massage has a wonderful hand massage. Just get into the muscle. Cover to the other one. As long as the person, again, doesn't have to go anywhere and they don't want, you know, if their makeup or whatever is, that they're okay. If they have a nose ring, just stay away from the nose ring. You can enter into the head either by putting your fingers backwards onto the forehead or lightly coming in onto the hairline. And again here, you can do little, any facial. If you've taken facial, if you've taken European lymph drainage, table shiatsu, there's a whole bunch of different little techniques that you can use with the face. On the head, what you want to do though, if you really want to pay attention to it, is your motions are towards the ears and then down the neck. So the lymphatic system, you can clear them by going towards the ears and then down the neck. Your anatomy book will show you the lymph. It will show you also the muscles. You can turn their head over. If you do have excess oil, you can take some off and then give them a head massage. Some people, if you actually take their hair and just give a little bit of a pull, it's more of a shimmy shake. You could have rubbed their ears. Also in the massage, once you turn them over, if you wanted to give them a pillow over their eyes, that's fine too. If you want to have them go into a deeper kind of meditation, relaxation while they're getting a massage. Just make sure then you dim the lights for them and warn them that you're going to dim the lights for when you take the pillow off. You can finish, it's a Reiki move, it's all up to you if you like it or not. It's just, you're not touching the body, you're just energy sweeping the body. And you're done.